Is it still morning? I have a newborn at home, so it's all relative to me. As Jack mentioned, we are very much a community-based program, so this is a unique setting for me. It's a little bit intimidating, but we're very excited to be here. My presentation will really focus on taking the opportunity to teach you all more about what's happening with the Ontario Student Nutrition Program. We'll talk about the recent evolution in the program, and we will focus on some of the program challenges because that's where it relates to the greatest opportunities around research and collaboration, and then we'll circle back to the opportunities for increasing population and patient health. Okay, student nutrition programs have been funded in the province of Ontario since 1995. They're currently funded by the Ministry of Children and Youth Services. And there's been an explosion in student nutrition programs. In 1995, the province was providing $4 million in provincial funding, and they're currently providing $32 million in provincial funding annually. And much of that increase has come just in the last 5 years. So the programs are gaining a lot of political attention. They are growing massively across the province. So currently there are more than 3,000 programs. Here in southwestern Ontario, just over 50% of schools have a program, and there's been a big shift in the delivery of the program. So many years ago, about a decade ago, the majority of student nutrition programs were really poverty-based initiatives that were operating in small corners of the school, feeding just the hungriest children who would come in, and they were very much not inclusive programs. So what we've seen over the last decade is a real shift where schools and parents are recognizing that all students need and can benefit from greater access to healthy food at schools. So we've seen the transition away from just breakfast programs that are serving cereal and toast in a back classroom to vibrant, full school, healthy fruit and vegetable programs, and also more vibrant morning meal or breakfast programs that now you can see when you walk in the front doors of a school. You sometimes see they pull out tables and operate healthy breakfast programs right there in the foyer of the school, and you can see anywhere from 100 or more students funneling through, grabbing a healthy breakfast. You see a lot more fruits and vegetables out at breakfast, kids picking up a piece of broccoli and peppers right there in the morning. So a big shift. And then the healthy snack programs, what you're seeing, the most typical model is really this full school program where the food is being delivered in some cases right into the classroom, and all of the students are having access to, it is required from the ministry that they have a fruit and vegetable with every serving, and that's usually complemented by a second food group or a third food group in the meal programs. Victorian Order of Nurses, where I work, is the lead agency for the student nutrition program in southwestern Ontario. And in our role as lead agency, we flow $3.2 million. Actually, that has just increased since we wrote this. It's now $3.4 million in funding to schools. So our primary role is to deliver those grant funds. We're currently supporting 480 school nutrition programs, and 10 million snacks or healthy meals are provided annually in these programs. Now, the vision really is to foster the long-term health and success of Ontarians by offering every child and youth fresh, healthy food each day at school. And so, as I mentioned, in the last few years, we're coming closer and closer to that reality of a universal program. The Ontario is more advanced than many provinces in student nutrition. Canada, it should be noted that Canada is one of the only G8 countries that doesn't have federal funding supporting school food programming. So our mission is to provide leadership in the design and implementation of a student nutrition program model that maximizes outcomes for children and youth through collaboration, innovation, and accountability. So previously, many of you there's been a lot of confusion around what the Ontario Student Nutrition Program is, and much of that is related to the fact that many of the programs all had different names. As regional lead agency, we work with 8 community partnerships across southwestern Ontario. So Chatham, Kent, Elgin, Huron, Perth, Grey Bruce, Lambton, London, Middlesex, Oxford, and Windsor, Essex all have a community partnership. The community partnerships involve public health representation, school board representation, and various parents and community partners who come around the table and have been doing so for over a decade to provide support for school nutrition programs in the respective communities. Many of those community partnerships previously had different names, anything from Jumpstart to Grey Goose Eat and Learn. But as of April 1st of this year, all of our community partnerships now have transitioned to use a common name, Ontario Student Nutrition Program, and then the respective community. And that's part of building this brand so that we can continue to grow and strengthen the program. So as regional lead agency, the areas that we focus on are food and logistics, resource generation, program development, and external relations. And I'll link this to some of the current program challenges. The biggest challenge, not surprisingly, is funding. Currently, we provide about an average of 15 cents per snack or meal served. So you can imagine that that's not a lot of funding. In terms of staffing, there is a small regional team. Up until just a couple of years ago, there was just myself. Our regional team now includes a food and logistics coordinator, some resource generation people, and in each of the communities there is a program coordinator who works with all of the individual school programs. So funding has been a major challenge for us. Under food, in addition, operational inefficiencies. So a major challenge is that all the programs are run by volunteers in the schools. So that creates a lot of challenges. Many of the school programs go out and purchase food via traditional retail venues. So that's a challenge that we're addressing. This fall, we just launched an online purchasing program where schools can log on and place orders for produce, and we centrally procure and deliver it directly to the door of the schools. So that's an innovative program that is opening lots of doors for us. It's creating standardized menus, it's creating opportunities to build in food literacy opportunities. It's really acting as a catalyst for local food networks. It's creating economies of scales. We've also looked at, we've had some conversations about expanding that to daycares, for example, in Chatham-Kent area, and potentially even institutions. Western itself, we've talked to their head of procurement and a couple hospitals and looked at things. We've been working on some social enterprise where we've been drying fruits and vegetables that would otherwise be dumped. And when we dry them, it gives us a cost-effective produce item to serve to students in the off-season throughout winter. In addition, we're looking at preparing fruit and vegetable tubes. So again, slightly value-added processed items that we can use both for social enterprise and to bring down the per unit cost of the food that we're delivering to students. BON also delivers Meals on Wheels. So we've done some social enterprise with our Meals on Wheels programs where we have high school co-op students prepping the meals. It brought the per unit price from $6 down to $2, and we're reinvesting some of that money both into student nutrition and other programs. So another challenge is research. There's a lack of Canadian-based research around the evidence of the positive outcomes relating to this program. We did a research study here in London, Ontario, across the Catholic Board. We received $300,000 from the Ministry of Agriculture to run a 12-week program, fruit and vegetable program, and we did pre and post tests with the students, with Dr. Rona Hanning, the University of Waterloo, and we were able to show a significant preference shift for certain vegetables, where students indicated prior to participating in the program that they didn't like things like red peppers, and then with as little as 3 exposures in a classroom setting, we found that post-test, they were indicating that they did like the red peppers was one that stood out. We also tried to do a 24-hour recall and look at more specific nutrient changes, dietary changes, and we do need to increase that efficiency around that methodology. So further opportunities for evaluation are, again, around the preference shifts is a big one. We know that fruit vegetable consumption can be linked, can have a multitude of positive health outcomes on chronic disease. So we think that this is a great place to leverage additional research so that we can begin to tap into sustainable funding sources with the Ministry of Health and Health Promotion. And I'm part of a federal or a national coalition that is pursuing federal funding, and we believe that that is going to be a valuable source of funding. So any collaboration around research in that regard will be very helpful. Food literacy programming, we're just beginning to formalize some food literacy elements to our programs. And again, the fact that we are now procuring and delivering food helps with this, because we can send, for example, we have a Harvest of the Month product where we give a profile of the farmer. We give little nutrition tidbits on the morning announcements, and so when the product arrives, the children have already heard the nutrition tidbit on the announcements in the morning and are more inclined to try the product. We've done things like challenges with some of our programs where we've challenged kids to eat things, even raw asparagus, and they get out there and do it. The peer influence has a really positive impact. Even some of our parent volunteers, I've been and seen it, they'll be serving broccoli and they're like, this is great, but my little guy's not going to be eating this today. And then sure enough, as we're wrapping up, her son is chasing after the cart asking for some extras, and she's just like, how does this happen, So really powerful program, dollar for dollar when you look at what's invested. So I'm seeing that my time is up, so I'm going to wrap up here and go into any questions.